Once you're ready to leave intensive care, you'll move to the progressive care unit. In progressive care, your most active recovery begins. There is a team of people working to help you recover. Your health team includes your doctor, as well as nurses, therapists, and you and your family. They all play a role in the recovery from heart surgery. The plan that is used to help you recover is your critical pathway. The critical pathway sets goals that you need to achieve before you leave the hospital.
Morning, Mr. Francis. Good morning.
Morning. Morning, doctor.
How you doing?
All right.
Okay. How you feeling?
Good.
Yeah.
Let me check my seat.
Okay.
Have it up here.
All right. Good.
Each day, your care team will monitor your health to make sure that you are recovering.
Let me have a listen here.
And each day you will have to do things to help yourself get better, like getting out of bed.
Mr. Thomas,
Yes.
how about taking a walk with me?
Well, I've been a little pain lately.
Okay, well, I've noticed you haven't had anything for pain today. I went ahead and brought you some pain med, and I figure if you take your pain med, you'll be a lot more comfortable.
Well, I don't like taking those pills. Do I really have to take them?
I think if you take one of these pain pills, you'll feel a lot better. You'll feel like moving around. You'll build up your strength, and I guarantee you'll get out of here a lot sooner. So, let me just give you this pill. Okay?
You'll be encouraged to get out of bed.
Yes.
How about if I help you out of bed into the chair for lunch? How would that be?
Okay.
You feeling better?
Yes.
Okay.
Morning, Mr. Beinecker.
One of your goals is to be as active as you can.
Now, would you like to have your bath this morning before breakfast or after you eat?
A bath? Didn't I just have open heart surgery?
You'll be fine. I'll set you up and you do as much as you can.
I had to bathe myself and shave. They wanted you to do it on your own, and they said I was there for recuperation, not relaxation.
You'll be surprised at how well you'll do. I'll set you up.
You'll walk and exercise a few times a day.
Not too bad. You take it slow. You don't have to run a marathon. Any pain in your chest?
Being able to walk around in the hospital and not feel any pain with it was just amazing to me.
To help you move around more freely, you'll receive a wireless heart monitor.
The important thing about moving around is, of course, it gets your strength back, and that's real important. And people usually feel a lot better once they start moving around and get out of bed, even though they don't think they're going to feel better. And it also helps prevent blood clots in the legs and helps prevent pneumonia.
You'll be kept pretty busy. You'll use a spirometer to help you use all of your lung capacity. You'll continue to walk, and coughing will help you keep your lungs clear.
I found out that you have to take control of your life. Nobody else is going to be in there pushing you and making you do that.
Mr. Richmond, I was just reviewing your critical pathway. It looks like you are achieving all the goals on the critical pathway.
The hospital staff will be working to make sure that your recovery is going as planned. Your family can help in your recovery. You'll be given a tremendous amount of information, and having someone else be aware of the information can help take the stress off of you.
Has he been eating?
Yes.
Family support could be a spouse, another family member, a friend, a church group, or whoever was supporting you before surgery. You need their support at home as well.
You won't be able to do everything that you did prior to coming in the minute you walk out this door, so you need someone to help you out with your activities of daily living.
You're not going to be able to do your shopping and your normal activities or run a load of wash down to the basement. So you're just going to have to depend on others for a while. Tell people, let the vacuum and the dirt go for a little while.
Hi, Mr. and Mrs. Thomas.
Hi, how you doing?
Good. How about yourself?
Just fine. He told me he's going to be coming home in a couple of days.
Yes.
Isn't that early?
No, I was reviewing his care with the cardiac surgeons and the other members of the cardiac surgical team, and they feel like he should be ready to be discharged within a day or two.
Okay.
He is achieving the goals of the critical pathway.
Okay. We're going to go over some of the things that you should not do because of the incision that you have in the chest or your sternotomy.
To prepare you to leave the hospital, you will learn what you should and shouldn't do at home.
Mr. Richmond, we've gone over your discharge instruction sheet here.
These instructions will be reviewed thoroughly. It helps to have a family member there to hear the instructions with you. All the instructions are written down in your discharge plan that you will be given when you leave the hospital.
Do you have any questions about anything before you leave?
No, I think that's fine.
You ready to go?
Well, I'm ready to go home.
Okay, let's get you in the chair. Safe trip home?
I wasn't sure I was ready to go home, but it's a good word to hear. Do you want to go home this morning? And I said yes.
When I walked in the door and I knew that I was out of the hospital and at home, I felt the healing right there.
I am Dr. Roger Stark. You've already met my partner, Dr. Joseph Austin. We would like to welcome you to Overlake Hospital. We realize this is an important time for you. This has been an important decision to undergo open heart surgery, and we are pleased that you have made a decision to stay here at Overlake Hospital in Bellevue. Our program began in 1987, and we have been very pleased with the results that we have achieved down through the years. As Dr. Austin mentioned, we have a very experienced team, now having done thousands of open heart operations. The typical operation takes between 3 to 5 hours to perform. Our patients from the operating room go right across the hall into the coronary care unit. The typical recovery in the coronary care unit is from 12 to 36 hours. From the coronary care unit, our patients go to the recovery floor on 2 East. At that point, they spend anywhere from 1 to 3 days convalescing in a regular hospital room. They learn how to feed themselves, walk in the hall, get in and out of the bathroom, get their clothes on, do the daily tasks. Then, once our patients are discharged, they are on an exercise program that basically emphasizes walking. We do not let our patients drive for approximately 2 weeks, and we do not let our patients do very much in the way of upper body activities for 6 to 8 weeks while their incisions heal. I should emphasize that open heart surgery is more than an individual effort. Open heart surgery is a team effort, and we feel quite strongly about that at Overlake Hospital. You will meet doctors, nurses, you will meet technicians. They all play a very key and integral role in providing you with the best possible care that we can. Again, I would like to welcome you to Overlake Hospital in Bellevue.
This ends part 1, your hospital stay. This is a good time to stop the program. The next part is the first days home.
You're about ready to go home now. For some of you, this is a very scary time, and for others of you, you can hardly wait to leave the hospital. When you get home, continuing the activity program you started in the hospital will be extremely important for a fast recovery. Please follow the guidelines given to you by your nurse and those written in the Red Book. They help outline the importance of adding time and distance onto your 4 walks each day. Another important key for recovery is taking regular pain medications. Without them, you won't feel like doing the activity, deep breathing, and coughing that's so important for your recovery. Pain medicines also can cause constipation. It will be important for you to have a bowel movement at least every other day. If you're having problems with constipation, please call. And feel free to call with any other questions or concerns you have. We're here to help you at any point in time. Remember to continue sternal precautions. That's no more than 5 pounds of weight lifted. Make sure that you use 2 hands when you're closing or opening a slider door or opening a car door. All of those will decrease the discomfort in your chest. Please feel free to contact me with any questions or concerns. I will do my very best to answer those questions or find the appropriate resource for you.